speaker today is Dr. Karishma Shaikh. She is an IFM certified functional medicine practitioner. She practices both conventional medicine for acute conditions and functional medicine for chronic lifestyle conditions. She currently is a functional medicine consultant at Ultrawellness. So she has her own journey of healing using functional medicine approach, and that is what also inspired her to learn more about this and bring it back to the society. So thank you, Dr. Karishma, for being with us. Dr. Karishma will be speaking about magnesium. So we just learned about a toxin element, and now we will be learning more about a very useful element, magnesium, and how it's a wonderful mineral for our body. So over to you, Dr. Karishma. You're on mute. Dr. Karishma, you're on mute.
Thank you so much, Dr. Ruhi ma'am. Hello everybody, namaste, and a warm welcome to all of you at the IAFM Conference 2022. I'm tremendously honored to be a part of this conference as a speaker, because last time when this conference was actually held upon, I was actually on the back end of this conference. A year before that, I was actually, searching myself for certain kind of practitioners where I would like to work upon with. And luckily, I met Dr. Anish Musa sir. He has been a mentor to me, and I'm tremendously honored that I am a part of a functional medicine forum right now, and I'm tremendously honored for the same. My topic for today is magnesium. Let me share my screen first. Is my screen visible, Dr. Ruhi ma'am?
Yes, it is.
Okay. My topic for today is magnesium and chronic disorders. I would just like to ask one question, and if you can put this in your, in your chat box. Over these years, like past 10 years or past 20 years, to whatever practitioner or health coach that you have gone to, how many times have you been prescribed a multivitamin that contains calcium, or a calcium supplement as a whole when you have had any kind of an ache and pain or tiny aches and pains inside your body? Because why magnesium? And secondly, my second question would be to everybody that why am I talking about magnesium, and why this mineral is so important inside our body that it is underestimated over decades of life. It was present previously. People used to take Epsom salt baths when I'm talking about our ancestors, but everything then modernized, then soaps came and the shampoos came, everything came upon, and this was lost as if it's not there only. So magnesium, which is a very important mineral inside our body, it is one of the most abundant minerals, but we never think about this as a mineral. Its role has never been understood, luckily, and because and also it is so important in around 300 enzymatic activities inside our body. Some of the researchers also say that it is around some 700 enzymatic activities, even the start of these enzymatic activities inside the body. Why many practitioners or many healthcare professionals, or I'm not talking about functional medicine practitioners, all of them know the wonder mineral. They all know about it. Some of the conventional medicine practitioners also know the wonder mineral that this particular substance holds. But when it comes to conventional practice as of a whole, where you have been prescribed anti-hypertensive medications, anti-anginal medications, a cardiac department is giving you all kinds of different medications to actually maintain your heartbeat and everything. I guess this particular prescription is always left. I'm not sure why it is left, but I guess let us learn today that what is the importance of magnesium, why it is responsible for so many chronic disorders. It is responsible also, and it may be lacking also in many chronic disorders. No specific, the one thing, because it was not taught in the medical school as well. So when I look back at the chapters of nutrition, when I see my first year books, that is biochemistry, so many enzymes and so many cycles. You talk about carbohydrate metabolism, talk about protein metabolism inside the body. Each and every cycle is utilizing magnesium. Even when we are talking about any kind of a cycle, like any inflammatory processes inside the body, any gut kind of the motility that's going on inside the body, everything requires magnesium inside our body. Okay. Why this has not been so of a hot topic as well? Because no accurate testing has been available to the public. Because we have only one testing, that is the serum magnesium testing, and that is a very non-specific one. There are many costly testings, that is the RBC magnesium testing and the ionized magnesium testing, but that is not available to the public. People always, whenever they are going for, and also it is not available on the when you are going for any kind of a reporting, when you have this list of reporting, there is no magnesium there, but I'm sure there is calcium there. So everybody of you know your calcium level, but you are never sure about your magnesium level. As magnesium, I see these days, and all of the practitioners, all of the functional medicine practitioners see that it has become it has become a fast growing supplement brand inside India and overseas as well. And it has also surpassed the sales of calcium. So when we are talking about nutritional deficiencies, we are talking about any kind of a nutritional deficiency. We are basically talking about calcium. We are basically talking about clinical kind of a nutritional deficiency and subclinical. Magnesium basically does not come more of a clinical kind of a nutritional deficiency where you have a lot many symptoms and you're not able to figure out, and you are constantly suffering from some kind of a chronic disorder. So it is not going to be an acute kind of a deficiency when we are talking about vitamin D and other, unlike other minerals and the vitamins. Subclinical kind of a nutritional deficiency, what is the meaning of the same? Which means that you have a nutritional deficiency, you don't have the signs and symptoms too much of the same, but it can predispose you to any kind of long-term effects of the same. Like long-term, it can put you to a risk of cardiovascular diseases, nervous damage inside your body. So that is why magnesium is so important inside the body. Magnesium, as I said, is the most abundant intracellular cation after potassium. It is the fourth most abundant cation in the human body. What are our cations? Basically, it's the sodium, potassium, calcium, and magnesium, right? Magnesium, as I said, is important in 300 enzymatic processes. It is responsible for maintaining the normal functioning of the nervous system, maintaining your blood sugar values, the blood pressure, making of the bone, and DNA. We always take into the consideration that it is calcium that is going to make my bone. So many powders actually, the protein powders also have calcium in it. So many brands are actually promoting calcium. Women are lacking calcium. Women actually, after the age of menopause, actually lack calcium. But please check your magnesium, because at times the calcium deficiency is actually, it is the camouflage of the magnesium deficiency inside the body. 50% of the total magnesium is found in the bone. The other half is predominantly found in the muscles and the tissues. Only 1% magnesium, and this is the functional magnesium. What is the meaning of functional magnesium? It is involved in all the biochemical processes inside your body, which is responsible for carrying out functions inside your body, right? Dr. Jerry Kawa of the University of Colorado calls magnesium as the mineral. Mineral means that it is the most important mineral when it comes to living organisms of any kind. Dr. Carolyn Dean, I am highly mesmerized by the way she has described magnesium in her book, that is the Magnesium Miracle. This is a go away, and I would really like you to read this particular book and understand the wonderful mineral magnesium and the effects that she has talked about. Calls magnesium as the spark of life. What is the recommended daily allowance of the magnesium? If we see, so it is basically dependent on the age years also, and it is dependent on what kind of conditions the patient is going through. It is also dependent if the patient is having a high demand of the magnesium in respect to any kind of an occupation that the person is into, or is having any kind of toxicities. But still, many people, many healthy individuals, I'm talking about patients as well, and I'm talking about practitioners, me myself included in the same, that over a period of 1 month, 1 month or 2 months, I actually take a magnesium supplement for my own self, because magnesium has to be taken as a regular kind of a supplementation. It is not a drug. So it is responsible for the processes, the biochemical processes inside the body, and the cells basically starve for the same. Major causes for magnesium deficiency, I have jotted this as internal factors and external factors. Internal factors, one is the physiological one, that is somebody who is having a very high athletic performance. You have a high sweating, that is there's a loss of magnesium through sweating. Somebody who is taking alcohol, is a chronic alcoholism, and is taking caffeine in larger amounts, understand that you might be magnesium deficit, because this, by the diuretic effect of the kidneys, it is basically being there is a depletion of magnesium. Somebody who's taking A lot of antibiotics, people who are taking antihypertensive medications, anti-anginal, any cardiovascular medications that you are taking antacids, because magnesium actually accentuates its processes when there is some kind of an acidity inside the stomach. So if you're taking a lot of antacids inside your body, you are actually depleting the stores of magnesium inside your body. Low potassium is also responsible for magnesium loss. Certain conditions, that is IBD, IBS, in many kind of gut dysfunctions, when we are talking about GERD also, which is the most common one, that is the gastroesophageal reflux disease, which means that the acid is coming up in your mouth. What is that? Basically, it may be one of the reasons would be the magnesium deficiency, because your sphincter is not able to open. That is why all this gastric content is actually staying in your stomach for a longer period of time and everything is coming up, which means that there is decreased relaxation. So whenever we are talking about calcium, I'll be talking about contraction. When we talk about magnesium, it is the most important relaxing mineral inside the body. The food that we eat these days is also not good. It is basically, fortified with a lot of chemicals. And so already it is deficit in magnesium. I'll give you a list of foods. I'll give you a PDF of the same, but believe me, still you will be deficit in the same because you don't know that from where this particular food is coming. Chronic stress inside the body, certain chronic conditions, that is heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease are also responsible for the depletion of magnesium and also increased need of magnesium inside the body. External factors, herbicides. We all know that the crops that you are eating, the crops that you are, just accumulating yourself and, focus, your pantry is being filled with a lot of other different ingredients, but you never know that the herbicides and pesticides and even fungicides that are sprayed on the crops actually depletes the magnesium from the plants. Acid rain, very important. The sulfuric acid and the nitric acid, when the acid goes down on the soil, the soil has a lot of magnesium inside it. There is a magnesium depletion because of the entire process that goes upon. I'll be speaking in a very layman language, so we are not going to go into the processes of the same. Food processing, yes, definitely, because you are drying out certain things, you're putting certain things in vacuum, you're adding salt to it. Junk food, yes, definitely. Somebody who is taking a high protein diet without the guidance of any functional coach or functional practitioner, please, if you're taking a high protein diet, you are basically putting a lot of load on your kidneys and your liver, which is basically not allowing the reabsorption of magnesium from the renal tubules. That is it's the main unit of the kidney. So that is also very important. Fluoride in the water is also depleting the magnesium inside the body. If somebody is taking it, fluoride is present in toothpaste, it's present in water as well. Infrared sauna therapy, it's a very hot shot therapy when it comes to weight loss. Everybody is going for infrared sauna. Yes, the benefits of same are tremendous and miraculous. But one thing that it depletes, and the most important thing, is magnesium, because there is a lot of sweating when it comes to infrared sauna, and it can be depleted because of the same. Refined grain, as we all know, the entire wholesome is just coming out, so we are not sure that what is remaining inside the grain. Clinical impact of magnesium. Entire human body is all interconnected. Say brain, so अगर हम ऐसा बोलते हैं that from your brain till your legs, everything has a connection with magnesium. I would be talking about a calcium magnesium pump as well, because calcium magnesium pump is responsible for, so the calcium, how it works basically. Calcium, so if I'm contracting my hand, there is some calcium that is going inside my cells and causing the contraction. If I'm relaxing my hand, which means that from blood, the magnesium is going inside your cells and it is replacing the calcium. Okay, so there is a constant calcium magnesium pump of contraction and relaxation inside your body. Calcium magnesium ratio, always of an importance when we are talking about, we see on the lab reports that the calcium is all fine, but the magnesium according to the functional reports is not good. So calcium magnesium ratio is very important when we are testing for any kind of magnesium deficiencies. General clinical impacts, as we know, arthritis, it can helps dissolve calcium. Asthma, it decreases the production of histamine, which is responsible for mucus. You're doing the lot of mucus comes up, right? This mucus coming up is basically the production of histamine inside your bronchial tubules. It also reduces bronchial spasms. Chronic fatigue syndrome, somebody who is deficient in magnesium and the calcium is very much on the excess side, may also be responsible for mitochondrial dysfunctions inside the body. Cystitis, that is bladder infection, some kind of an inflammation at your urinary bladder. Both infection and bladder spasms are related to the same. Kidney diseases, there's calcium buildup. There is a calcium buildup, which then causes atherosclerotic plaque, which is responsible for the flow of that particular kidney, and the flow is basically disturbed, which may be responsible for kidney failures. And it may also be in the longer run, it may also be it worsens the blood sugar levels in transplanted kidney patients as well. Kidney stones, and kidney stones. Whenever you think about kidney stones, your USG showing kidney stone, check your magnesium first, because it may be there is some deposition of calcium, and this calcium is not able to replace, the magnesium is not able to replace the calcium, which is actually holding up uh, calcium at place, which is causing the stones. Tooth decay, yes, magnesium deficiency actually alters the salivary amylase and everything uh, inside your mouth, which may be responsible for the same. Nervous system, as we know, depression, serotonin actually elevates the mood, is also magnesium dependent when we talk about tension headaches. You have a tensile headache. This is not a headache which is coming from tension. It is basically a tensile headache that your muscles have been in a long-term contraction. Okay, so these basically cause various kinds of spasm inside. Any spasm that you're talking about, I guess magnesium is the cause. Alzheimer's disease, deposition of calcium and heavy metals inside, which basically blocks the neuro regeneration and degeneration that is being blocked. Parkinson disease, that is dopamine basically is responsible for the same, and it is just hindered upon by the magnesium. Insomnia, yes, somebody who is having insomnia, try magnesium, because it will just give you a restful sleep by increasing the levels of serotonin and melatonin as well inside your body. Burning pain, muscle weakness, numbness, paralysis, pins and needle sensations, seizures, convulsions, skin sensitivity, tingling, twitching, and vertigo, confusion. They are also response as magnesium deficiencies. Detoxification of heavy metals, and if somebody's, because it is a cofactor in the production of glutathione, which is the most powerful antioxidants, right? Homocysteine, which is actually responsible for converting your toxins into non-toxic form inside the body, also requires magnesium. Diabetes, it is responsible for secreting insulin, which is actually the hormone which is going to put your glucose. Glucose was never meant for the blood. So glucose has to go inside the cell and convert into energy. So this particular thing, that the glucose has to go inside the cell and convert into energy, one of the 10 steps made, the 7 steps that we are talking about, magnesium is required for the carbohydrate metabolism. Hormones, yes, we are talking about adrenal fatigue. If you have high cortisol, high adrenaline, high noradrenaline, there may be chances you are magnesium deficit. You are having dysmenorrhea, menstrual cramps, and you're not able to, you are just shouting out loud because of the menstrual pain. Could be because there is a constant contraction because of magnesium deficiencies. Gastrointestinal system, as I already talked about, that it is the GERD. So there is a contraction at the level of the pyloric sphincter. That is the sphincter that is present between the stomach and your small intestine. Acid reflux, as I said, LES spasms, and indigestion, because it actually promotes the secretion of acid inside your stomach to digest your food. IBS is actually tackled well when the person is given a magnesium supplementation, because it reduces the pain and spasms inside the body. Each and every muscular system, musculoskeletal system pain, if you're having, there is excess calcium at times, and there is a lower side of magnesium. Muscle cramps, if you have had a restless leg syndrome, you are just sleeping in the night and you suddenly had a cramp, go for a magnesium testing. I guess that's deficit. Fibromyalgia, tension headaches, muscle spasms, go on and on. Any musculoskeletal system, we need to supplement it with calcium. Magnesium. Cardiovascular system, very important for us. We all know the inflammation which is responsible. So we all think that it is the cholesterol which is responsible for, the high cholesterol which is responsible for some kind of the cardiovascular damage inside our body. But it is not the cholesterol. It is basically the calcium depositions. If I show you, every cardiologist is basically doing these kind of testings where they are seeing the calcium scores. They're actually seeing the quantification of coronary artery calcium inside your vessels, and then depicting that what is the blockage, how much is the blockage inside the patient's body. See the mineral that they are testing the calcium, which means that there is constant calcium deposition inside the body, which may be because of inflammation, and then there is a deposition, and then there is the magnesium is not on the higher side, or it's not on the optimal, it's not optimally there. Because calcium is a pro-inflammatory and magnesium is an anti-inflammatory. Left ventricle, that is your left side of the heart, is having the highest amount of magnesium in the whole body. Okay. Also in hypertension, it is very important because relaxation of smooth muscles. Why hypertension is occurring in the first place? It is because contraction of smooth muscles at the level of your arteries. Anginal pains. Magnesium is a natural statin. If one thing that you want to take from this particular presentation, just take this, that magnesium is a natural statin. It lowers your LDL and it improves your HDL, that is your good cholesterol. Because whenever you're taking an anti-cholesterolic medication, you are actually disrupting the entire pathway of the formation of cholesterol, the depletion of cholesterol. But magnesium maintains this by maintaining the normal biological processes inside the body. Magnesium and hyperhomocystinemia. This is basically responsible for, as I said, toxin overload inside the body. And because there is a lot of depletion inside the body of the patient, as per se when magnesium comes into role, as I said, fat deposits, free radicals, high blood sugar, they initiate some inflammatory processes and attracts your bad cholesterol, right? So it is basically the deposition of calcium-like things or some inflammatory kind of proteins which actually will attract your bad cholesterol, and they will build up some plaque form of thing and they will form a scarring. So that is why always check your homocysteine when you are checking for your magnesium as well, because homocysteine is responsible for removal of toxins from your body. One more thing, that nutrient also requires each and every nutrient: stock, zinc, selenium, vitamin D, A, K, boron, everything requires magnesium for, and these kind of minerals also are responsible for maintaining the magnesium. Specifically, I want to talk about vitamin D. Magnesium is necessary to convert the storage form of vitamin D. Also, when we are talking about calcium, calcium was meant to stay inside the bodily tissues or the bones. So magnesium, with the help of vitamin D and K, basically takes up the calciums to their particular levels. Okay. Ways to test magnesium. The first one is the oral clinical trial, where we basically just try to supplement the patient with the magnesium and see the effects that the patient shows up. Magnesium RBC testing, this testing is very accurate, but it is not available for most of the patients. Ionized magnesium test and serum magnesium test. See the values of magnesium here. The normal value should at least be 2.2 to 2.3 mg per deciliter. But see the deficiency that the patient is having. Also, the patient is having calcium deficiencies. Usually, conventionally, when we treat these kind of patients, the doctor or the practitioner gives the calcium as the first go. No, we wait with the patient. We actually supplement the patient with magnesium, because the magnesium is going to go inside the cell and it is going to replace the calcium, and the calcium in the blood is going to be available. So your calcium also improves and your magnesium also improves. So yes, many forms of magnesium, very, very important. Before you buy, look at the bottle. The bottle is very important, or the powdered bottle is very important. What do you have to see on the bottle? Elemental magnesium, because of the absorption percentage inside the body. See a chart here that there is some magnesium oxide, there is magnesium carbonate. All of these oxides, carbonate, malate, citrate, lactate, glycinate, they are basically ligands which are attached to magnesium. So this is not a whole of magnesium, right? The elemental magnesium which is in these products, it's basically, see, a list is given. So if you would consider that magnesium oxide is having the largest amount of magnesium, I should take the magnesium oxide. No, but it depends upon the absorption, because of the 300 mg, only 4% is going to be absorbed inside your body. Rest everything is going to go out of the system by the stools or by the urine. Okay, which means that out of 300 only, or out of 500, only 12% was utilized. That is 12 mg was utilized. Rest of the 488, the 500 mg salt that we are talking about, rest of the 488 is actually just a waste. So it actually moves out of your bowels and it moves out of your urinary tract. So elemental magnesium. So it should be 100% absorbable and it should be 100% bioavailable, right? Serving size. Look at the bottle or look at any kind of the powder. If the powder is saying 3 scoops, which is giving you the elemental magnesium as around some 100 mg or 200 mg, right? This is very low because you are increasing the dosage and then you are achieving that daily dose inside your body. Even that is not ethical, because at times taking huge dosages of these kind of magnesium, the combination magnesium basically causes laxative effects, and then the patient comes with that the patient is having a lot of loose motions because the rest of the things actually goes out of the system. Ligand salts holding the elemental magnesium. Most common used ones is the angstrom magnesium, which is basically a picometer kind of a thing. This is 100% absorbed. So even if I take 12 mg of angstrom magnesium, I will be getting 12 mg of angstrom magnesium. If I take 100 mg of angstrom magnesium, I'll be getting the whole 100 mg of angstrom magnesium without any kind of an effect at the bowel or any kind of effect at the level of, the effect, the localized effect is there, but there is not too much localized effect that everything is just going to go out of the system only. Natural calm magnesium, this is basically ionic magnesium powder. This is best for patients who are suffering from constipation, who are suffering from any kind of a gut disorder, because it has a lot of local action at the level of the gut. Epsom salts, that is magnesium sulfate for bathing. We do not recommend at all magnesium aspartate and magnesium glutamate because a neuro physician actually once said that they basically, whenever they are broken down inside the body, they release aspartic acid and glutamic acid, which are dangerous excitotoxins inside the brain. Okay, so these are the forms of magnesium. This is calm ionic magnesium. This is a venture by Dr. Anish Musa. While he was treating his patients, while he was treating himself, he came out with this particular thing that, because supplements are one thing that should be available in the therapeutic grade kind of a thing. So just putting the exact amount of therapeutic grade, just putting the exact composition of the same, and being that particular thing available to the practitioner as well and the patient as well, right? So see the magnesium, this is as 310 mg. So which means that the elemental magnesium in this is around some, 85 to some 200 mg that we see. This 100 mg is absolutely the entire 100 mg of angstrom magnesium that we talk about. When to take magnesium? Always consult your practitioner and then start, because at times if you have a lot of toxin load, you have to go very slow with the magnesium, because you might be very uncomfortable, because there is a start of all the 700 to 800 enzymatic processes inside your body. And it also depends on the timing of the magnesium that you have, that has to be adjusted with the patient. Okay, so please contact your functional medicine practitioner whenever you are taking magnesium, as it is important, as we don't want any kind of laxative or these kind of effects. There is no high doses cannot give, especially calm ionic magnesium and angstrom magnesium are not going to give that. But just one thing that is looked upon is the loose stools at times, and also patients can feel uncomfortable if they have had a lot of, if they are having chronic disorders since a long period of time, and they are not being able to start their 700 to 800 enzymatic processes inside the body. So if the engine of everything starts together, just this is a diagnostic testing that you are definitely deficient in magnesium, and then we have to go very slow with these kind of patients. Okay, contraindications of magnesium therapy. Yes, kidney failures, myasthenia gravis, because there is already a lot of relaxation. And so please take under a guidance of a functional medicine practitioner. Please don't take it just by yourself. Buy a bottle. I am very deficit in magnesium, I'm going to start magnesium. No, it's not a drug. It's a supplement. It has to be matched with your circadian rhythm. Okay. Excessively slow heart rate, bowel obstruction as well. So we have to just manage these things. Bone and muscle health, as I said, that calcium in the blood is basically to be taken to the actual site. It is magnesium and vitamin D which actually takes the calcium to its preferred site of action from the blood vessels. Calcium was never meant for the blood vessels. It has to go at the preferred site of the tissues or the bones, especially the bones. Okay, thyroid maintenance. Magnesium is responsible for detoxifying. If somebody is having Hashimoto's disease, if somebody is having thyroid dysfunction, subclinical thyroiditis, magnesium with thyroid support basically does wonder in these patients. So yes, that's the thing. This is the address of the website address for Ultrawellness if you want to buy any kind of supplementations. This is for the patients. And we will also be sharing some gem pearls of the magnesium. And we would also be sharing the practitioner and the health coaches where they can register to actually order any kind of supplements if they want to from Ultrawellness. Thank you so much.
Thank you, Dr. Karishma. That was very insightful, especially looking at the bigger picture where we just don't look at one element, magnesium, but rather see the interconnections and then accordingly supplement, any patient who comes to us. Thank you so much. I'll take one or two questions from the Q&A.
Yes.
So,
Yes.
zinc and magnesium should not be taken at the same time. So can you just put some more insight on that?
So I guess this is absolutely a myth kind of a thing, because zinc actually is responsible for magnesium, increasing the magnesium absorption at the level of the gut. So because many of the articles say that zinc should not be taken with magnesium, but there are many articles that are proving that zinc should be, there's no contraindication of taking zinc with the magnesium, because it is going to be responsible for, as I said in the previous slides, that zinc is responsible for maintaining the constant absorptions of magnesium inside the gut system.
Right.
It basically depends on what type of magnesium you're taking. So if you're taking a magnesium oxide, if you're taking something that is attached to a ligand, then definitely when the ligand basically comes up and then the oxide breaks and then there is zinc. So zinc with the oxide is going to form zinc oxide, which is actually poisonous. So it depends on what ligand of magnesium is that you are taking for supplementing your own cell.
Right. Yeah. So another question, are plant-based magnesium supplements, like, those based on spinach, greens, etc., are they good and bioavailable?
Okay, so that's a very wonderful question. But as we all know, foods these days are very, there's a lot of fortification, herbicides, fungicides. Also, when we are talking about magnesium deficiencies, see, when we are talking about sunlight, so sunlight cannot, it's not going to fulfill your deficiency. It is just going to maintain your values. So same goes for any kind of a food. If you are taking I had a patient, the patient was so magnesium deficit, and the patient took 12 bananas in a period of 2-3 days, because banana is very much rich in magnesium, but the patient then had constipation. So it basically depends on what you want to achieve. So if you want to achieve a maintenance, yes, then we can, because eventually we shift from the supplement to the food. But when you are looking for any deficit states, if your value is 1.99, if your value is 2, I guess you should be looking for supplementing yourself with the correct dosages and under the guidance of a functional medicine practitioner.
Yeah. Thank you. Okay, I'll take one last question. So you spoke about taking magnesium, matching it to the circadian rhythm.
Yes. Because magnesium absorption is more, that's a wonderful question as well. According to Dr. Carolyn Dean, magnesium absorption is at its maximum when it's in the morning and in the evening. So the absorption is basically maximum, and the utilization of magnesium, because start of the chemical processes inside the body, the enzymatic processes inside the body, and end of the enzymatic processes inside the body, that is happening at the night time. So that is why magnesium is important. Somebody who wants to take according to circadian rhythm, the recommended time is take in the morning and take in the evening. If you can take, but this goes for if you're taking some strong magnesium or calm ionic magnesium, you can take it throughout the day as well, because they do not interrupt with your circadian rhythm as well, because they are 100% bioavailable. So they actually get absorbed as soon as you take them.
Right. So I hope that answers the question. So, all right. So thank you, Dr. Karishma, so much. And
thank you so much. Thank you so much.
Yes.
Thank you so much, everybody. And it was a tremendous pleasure to talk about magnesium as a supplement. Thank you.